Mm, 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 mm.
Dice is on the beat.
Hey guys, welcome back to another YouTube video. It's been a minute. I'm lying, it's been a long time since I recorded a YouTube video. So, this video, as you can tell by the title, is called After Surgery Life. So, for those of y'all who've been following me on Instagram, y'all know I had surgery. So, the surgery was pretty much an emergency surgery. It wasn't really planned. It was supposed to be planned, but things changed. So I'm gonna go back to, I don't even know what month this was when I got a CAT scan, but I think it was maybe, was this December? Maybe like, oh, it was October. Because I remember I got the CAT scan on Halloween. So on Halloween, I had got a CAT scan. The CAT scan showed that my stomach was dilated and big, which is not normal. In the picture that I'm gonna show y'all, it looked like I was pregnant, which I wasn't. One night, it was like 1 something in the morning, and I was asleep, but then I started having sharp pains in my stomach. So I had to text my mom and told her, like, you know, I'm having pains. We need to go somewhere. So we went to the emergency room, Anne Arundel Medical Center emergency room. So they finally got me back there, and we met with a surgeon. Now, originally, I was supposed to meet with a different surgeon out in Tyson's Corner. I had an appointment for like November 28th, but this happened way before that appointment. So we met with the surgeon in the ER, a different surgeon in the ER, and the surgeon was just like, yeah, you need surgery. And I think we all knew that. My parents knew that. I knew that. But they kept like holding it off because they wanted me to gain weight, and they didn't want me to be now malnourished. So the surgeon in the ER, him and his team was just like, yeah, you need surgery. At first they was trying to send me to another hospital, and my parents were just like, why? We're already here, you know, like, just do it here. So the surgeon was like, yeah, we're not sending you to another hospital. We're gonna do it here. So I was happy. You know, who you know want to have surgery? Nobody wants to have surgery, but with my situation, I wasn't gaining weight. I felt like my health was just not where it needed to be. Nothing was changing. So I felt like I need surgery. Like, I wanted the surgery. Like, some people feel bad for me because they're like, oh, I'm so sorry you had surgery. I'm like, don't feel sorry for me. I wanted the surgery. I asked for the surgery. So the surgeon was just like, yeah, we're gonna do the surgery here, right now. And I'm like, okay, I'm ready. This lady, she had put this, I had an IV in. While they was rolling me back to the not the emergency room, the operating room, she put this stuff through my IV, and I'm like, I looked at her, I said, what is that? Because, you know, you're supposed to ask questions. If you don't know what they're putting through your IV, ask questions, okay? Because you don't want them to just give you anything. So I asked, I'm like, what is that? It was some clear, like, liquid stuff she put through my IV, and she was like, oh, it's for anxiety and something else she said. But next thing you know, I was out. After the surgery, you go to recovery room. Okay, so that's where all the patients who had surgery, you're all in a recovery room, okay, recovering from the anesthesia, okay? So anesthesia is a really strong medicine. Every time I've had procedures or surgeries, it's hard to wake up from anesthesia, but you do eventually wake up and you're alert and all that stuff. Catheter is a tube that goes in your private area or your pee hole, and if you have to pee, you just pee, and it goes through the tube and it goes in a bag. Okay, that's what a catheter is. Women get it and men get it. Now, men, if you was to have surgery and get a catheter, it will go in your pee hole, your wee hole. Okay, and for women, it will go in the pee hole. All right, yeah. It was a little uncomfortable having a catheter, but I did like the fact that I didn't have to get up to use the bathroom. If I had to pee, just pee, goes through the tube into the bag, and then the bag part, there's a little part on there you just unravel and just dump it in the toilet. So I'm gonna talk to you about this other wound. Okay, so I was in the at this point I was in my hospital room, recovering, stuff like that. It was one day physical therapy had came and they wanted me to walk the hall. No problem, I'll do it. If it's gonna help me, I'm gonna do it. So before I went to go walk with the physical therapy, my surgeon came in to see me. Every day he would see me, ask me how you feeling, look at all of everything, you know, look at their work pretty much. So my nurse had saw that I had a little bit of like pus, almost where my private area is, where they cut me pretty much. So she had called my surgeon. The surgeon came up and stuff like that. This almost made me pass the hell out. I mean, Q-tips, like medical Q-tips. So first he kind of did this with his hands to get the pus and the blood out. So squeeze some blood out, squeeze some pus out. Next thing you know, I hate this. I almost fainted, y'all. I almost fainted that day. I was feeling lightheaded when he did this. So it was 2 Q-tips, long Q-tips. He took the Q-tips, and this is where they cut me, like almost on my private area. Well, it was on my private area. This is the flat part, the top part of my private area. He took the Q-tip, did this with the Q-tip, and he slit. All this blood started coming out. Just a little bit of pus. But they said sometimes that happens with surgery. I was in pain. It was burning. I was like, oh my God, and I gotta walk after this. I gotta do physical therapy. Now I'm in pain. So after I came back from the walk and all that, I did ask for pain medicine. The thing about Crohn's is you lose a lot of weight. Like, I'm not talking about 5 pounds, 2 pounds. When I was healthy, I was 133 pounds, which is normal for my age and my size. This is embarrassing to say, but I'm going to say it anyway. Right now, I'm like 83 pounds. And 83 pounds is not normal for my size. After surgery life, it's been pretty good. I've had a couple downfalls. I had a really terrible nosebleed to where I had to go back to Anne Arundel through the emergency room. I thought it was going to be mucus. It was blood. I hawked up blood, a blood clot. A big blood clot. So like in the ER, they gave me this clamp thing to put on my nose. It's supposed to stop the bleeding and make sure no blood come out. So I'm gonna show y'all a picture of that. I was suffering. So I told my mom, I was like, I want to blow my nose. She's like, I don't think you should do that because it might start bleeding again. I said, well, I take my chance. So I blew it, but I didn't blow hard. Here you go. Just started running again. So I'm trying to get tissue to like catch it. It's like every time I put tissue, it soaks up the tissue. So I'm like, okay, throw that away. Here it come again. Just rolling down. It just came down so fast that I couldn't get enough tissue, new clean tissue to, like I could eat something and about 10 minutes later I'm hungry again. Like what is going on? I mean, but I'm happy though, because the whole goal of me eating a lot is to gain weight. I'm not like anorexic skinny, but I'm skinny for my size. So the whole goal now is to gain weight. And then I've been having back pain since before my surgery. They thought originally, okay, you have this surgery, we take out the back colon, you won't have back pain no more. In my tummy, some fluid. So they put a second drain in on my right side. Eventually, the second drain started giving me problems. When I say problems, it gave me pain. Certain like ways I move, it felt like I could feel the tube hitting something inside of me. And that's not normal, When they put the drain in, I was wide awake, but they numbed the area. So it didn't really hurt, but I did feel a little pressure. They said when they put the tube in, I was going to feel some pressure. I did feel some pressure, but it didn't really hurt. Sleep. You know, people say get rest up. You don't get no damn sleep in the hospital, okay? Every time I would go to sleep and I would get comfortable and actually be in a comfortable position, here come my nurse want to take my damn vitals. Oh, it's medicine time, or a certain doctor come in want to talk to me. You don't get no sleep in the hospital. There has been some nights I did get some good sleep, and there was certain nurses that I had, they would let me sleep and stuff, but you really don't get no sleep in the hospital. Like, it's like when you go to sleep and you're comfortable, that's when they come in and want to mess with you. And in the morning, every morning, they would take my blood. So I'm up for that, because I'm like, I need to feel when y'all stick me. You know, I don't want to be asleep and be caught off guard and y'all stick my ass, and I wasn't expecting it. So once they put this drain in, that's the only pain I had, and the back pain. But none of this bothered me. Where they cut me, all that stuff, this drain on this side, none of this stuff bothered me. And it was weird, because I told my mom, like, I was prepared to come out of surgery in pain. I thought I was going to come out of surgery in pain, but I wasn't. Even in the recovery room, like once I woke up and the anesthesia wore off and stuff like that, I felt the staples and stuff. It felt tight, but I didn't feel no pain. So this is where right here, I just have another scab come off. I've been having scabs come off, which is good because it's healing up. But this is right here is where the old drain was at. Right here, this is old. This is real old. This is when I had my colostomy bag. So this is an old scar, but this is a new scar. That's where I had my the drain that was sucking out all the bad stuff. That's my first drain. And then all my where they slit me at. It's actually all of this has scabs on it. All the scabs fell off, which means this is pretty much healed up.